Hello, he's Shabazz.
He's Pete Marshall, and we're back again. We have a guest again. Do you want to tell us who it is, Pete, or do you want to let them introduce
We have Piers, who's going to be talking to us about the care home situation around coronavirus. Sorry, it's kind of one of the running themes of the podcast at this point. But yeah, Piers is really good about this. So, do you want to introduce yourself?
Hi, I'm Piers, back again. I was on a couple of weeks ago talking about disabled students, but this time, as Pete's mentioned, it's about care homes. I currently work as a freelance, sort of general disabled in expert EE type person. For example, I work with DNA, diversity and ability, bit of a clap name, but we love it, on their higher education, student partnerships and policy stuff. So I've got there's a reason that I get tapped to talk about disabled students and national care policies.
Yeah, so the first thing we're going to talk about is the actual care home situation. And should we start with giving a bit of context about what happened in the supposed first wave of this?
I think that's an excellent place.
Any long-term viewer has probably heard about some of this, but remind everyone, and for anyone who this is their first episode.
So I'll just give the headlines of, not social media headlines, but the headlines of the instances. Advance warning: these are not nice figures, but this podcast is used to that. So first things first was that there were significant PPE issues nationally in the UK that primarily affected care homes in particular, which also meant that there was with the discharge policy that the government had, the national guidance said that you could discharge COVID positive people back into care homes. There was at least 30,000 excess deaths regarding care homes within the first wave period, as it was called, those 2-3 months that is classed as the first wave. And whilst there is, it is excess deaths to do with comparative to last year's period of care home deaths related. There's systemic issues that were there. There was a huge public outcry back then and still now. As of June of this year, there was a call for a public inquiry, and you can find that petition as well on the government's petition page, which is calling for a public inquiry into how so many disabled people were left to die in care homes due to the pandemic crisis, and on top of that, why it was a national policy, why the policy wasn't more of a good practice standard than a abandon and oh well standard. And that's just to do with institutions and care homes, the stats that we know of, due to the way in which these institutions and the hospitals and the government work. We know that these stats are vastly an underestimate of deaths, particularly with the fact that care homes don't even sometimes register their patients or internees, or inmates, as some in the disabled people's movement call them, as disabled on any national register. They just have them as people that live there. So there's a lot of systemic issues with the way in which things were happening previously, and with the spike that we have in COVID right now and the calls for it being a second wave, it's come once again back up to the forefront as, to quote quite a lot of fantasy stories, history is deemed to repeat itself. This is sequel number 2 of the trilogy that we really didn't want to repeat. It feels like a JK
Coronavirus, the new dawn.
Exactly, yeah. It's the new dawn. It's the new 50 Shades of Grey. It's the new JK Rowling said something on Twitter.
But my question is, how collectively, how do you think we kind of avoid that / prevent it from happening?
I think the first one is just understanding the situation as it stands right at this moment. I think it's incredibly important that we as a community, but also our allies, who might be listening to this and maybe not identify as disabled yourselves, recognise exactly where we are so that we can adequately find what the issues are, identify the issues that we previously did, and lobby and campaign, which I will have some advice for once I've explained the current situation as it stands right now. But to lobby, campaign, work together collaboratively, work digitally, work smart, because Christ, it's tiring in a pandemic without having to try and make sure that we're not being left to die. On top of that, we've got to understand where we are right now. And the first thing with that is the ONS, the Office for National Statistics, for those that aren't a policy wonk like myself, who know all of the acronyms as except LOL and things like that. ONS released a bit of disability-related stat package, report, article, whatever you want to call it, that has been picked up in the social media. You may have read it. It's the 60% death for, COVID deaths. 60% of COVID deaths are disabled people. Now, that is a harrowing statistic off the bat. I think the actual stat is 59% to be a pedantic individual that they reported. But there's some important aspects to talk about that article, in and of the fact of how they classified someone as disabled, what they classified as part of their pool of COVID deaths, as well as one particular issue that I want to talk about as well, which is that it didn't really go into any additional analysis other than, they died. So I think the first glaring issue is that you were only classed as part of that stat package, that 59% deaths, if you were a disabled person in a private household. So that's care homes out of the picture, that's institutions, assisted living centres, student housing, to a certain extent, if you're disabled in student housing and contracted it there, and whatever it is, if you don't get classed as living in a private household, you are not part of that 59% stat, which disabled people are significantly more likely to not be in a private household due to the nature of the fact of our society. The second one as well is it based its data of who is disabled off of the 2011 census. So the census that was conducted almost 10 years ago. And in that census, the way in which they classified whether or not you were disabled was a question that asked you to tick one of the following boxes. Are you limited a lot, limited a little, not limited at all? And that was the definition of whether or not you identified as disabled. It was, do you hate yourself? Do you hate yourself not so much? Or do you find yourself not having any limitations? Very medical model approach, even though the social model came out in the freaking 70s.
So essentially, the only people who could say not limited at all is like God, I'm assuming. I have no limitations. I can do anything under any circumstance. Sorry.
I'm laughing because I find the classification really absurd and almost it's just laughable to me. Limited a lot and limited a little. That's not very scientific, is it?
Well, it's based off the national census, which is just to try and, it's a census. It's basically a broad survey to try and find out everything and anything at once. So it's very bad in defining disability, but it also inherently doesn't even catch disabled people.
Yeah.
Because we already have a community that likes to identify in multiple different ways, and we always have a community that really struggles with disclosure in the first place. But when you have to disclose how limited you feel you are in a national census, it's going to miss people that don't consider themselves limited, but do consider themselves disabled. So if you've got asthma, which is something that COVID, you could be at risk of, greater at risk of death due to catching COVID, or you might be on the shielding list. Without a pandemic in the picture, you probably wouldn't have ticked a box saying that you felt limited at all, other than, you're not going to be running marathons anytime soon, and you'd rather take the lift than go up 30 flights of stairs.
Yeah.
You may not consider yourself to have been under one of those categories, and therefore you wouldn't have been classed as disabled in the census. And therefore the ONS research in the article that they produced, you wouldn't have been classed as disabled in that 59% stat category. So not only is it a vast estimate in the first place, because 10 years is a long time for identity of disability, if you weren't, most people our age might not even have been encompassed in that survey, unless they're just classed as a dependent. So there are systemic issues with it being a huge underestimate. And that is a shocking stat. Some of the off the cusp bit of research analysis that I did, I collected as much data. I took the 30,000 excess deaths from care homes, broke it down into the months that the ONS looked at, and just took that percentage of excess deaths and added it to the disabled category of the data that they had. It just included, non-private households from that status stat. It's not a robust analysis. I'll hold my hands up right away and say there's huge problems with it. But that bumped the stat up to at least 75%. So that would go from, under 2/3, 59%, 60%, over to 74, 75%, which is 3/4. 3/4 of people that died from COVID would have been classed as disabled even under the census rules. So there's systemic issues with that bit of data, but that's the most widely reported data, so it is useful. And it's important in this particular conversation, and it's getting quite stat heavy, it's getting quite terminology heavy, and I do apologize for that. But it's really important to understand the basis, because the official Office for National Statistics didn't include care homes in their survey about disability-related COVID stats, or it didn't include the statistics influence from care homes and assisted living centres. The government national policy is still to discharge COVID positive people into care homes, but just have them isolate in their room for 14 days, because that's exactly how care homes work. No one enters your room at all for 14 days. They don't go from your room to the person next door to the person next door, and they don't have a legal requirement to check on you every couple of hours to make sure you're not having any issues. What could possibly go wrong with a quarantine in an enclosed environment where you're having to isolate for 14 days? What could possibly go wrong? For those that didn't pick it up, I was being incredibly sarcastic. The second one as well is that there's currently issues with the test, track and trace system and the COVID testing system. I'm not going to touch on Moonshot too much, but there is issues with being able to access a test to the point where you can tell the care home or not whether or not that patient feels safe in going back, or whether or not you can guarantee they have COVID or not. So even if they were positive, they could still be discharged into a care home. And even if you are unsure, they could still be discharged into a care home without the requirement to isolate for 14 days. Without even touching on the issues of PPE, the government have confirmed and have made a promise that care homes and institutions like care homes will get free personal protective equipment. But considering the issues with the first wave that still haven't been fixed 6 months later, that can't be a guarantee. So the current situation is still allowed to discharge into care homes nationally, still allowed to discharge even if they are COVID positive. There is still, whilst there is a commitment to provide PPE, there is still no guarantee that the issues that were previously there have been sorted whatsoever.
Yeah.
There are still systemic issues with ensuring that staff of care homes can get adequate testing to ensure that if they have COVID or are asymptomatic, that they're not passing it on to residents. And whilst that is incredibly hard, on top of that, you can discharge a person into a care home with COVID, but you're not allowed any visitors. So these people are by themselves on their own, with only staff and maybe some of the friends they've made within the institution able to come and see them, whilst still being allowed Barry back from the hospital with COVID into the room next to you, but you're not allowed to see your friends and family. So there's a mental health impact as well. And all of this comes in such a national policy package that it's very disheartening, but there is stuff that we can do to fight this. There's stuff that we can get involved in. And I think Peter and Shabazz will probably want to jump in here and discuss some other things as well. Probably got more questions, but I just wanted to sort of address the doom and gloom is quite bad. It does sound terrible, but there is stuff that we can do.
Yeah.
And that is why, whilst I am come across as incredibly cynical and sarcastic, if this is, I am smiling. There is opportunity ahead of us to challenge the national policy, to challenge local policy, to challenge how your local council and local health board respond to national policy as well.
And I wanted this to be like a discussion between us. So it was like what I'm trying to get at in here. What I want to hit on is if a policymaker or somebody in some sort of power was listening to this, what do we think collectively that they should do from now on? Like, I'll give you an example. First thing I think they need to fix is the testing and the availability of testing and the quickness of the results. That needs to be a lot more quicker than I think it could be. And I think they need to focus on building more capacity for that instead of just saying, oh, it's a capacity issue. Well, fucking fix it then. If it's a capacity issue, you've had 6 months, do something. And it's not as if nobody knew the second wave was going to happen, because we all knew it anyway during the winter months. Everybody was saying it right from the beginning. Oh, we don't know what will happen in the winter months, so we have to be prepared for that. So nobody's got an excuse of, oh, we didn't know this was going to happen. Every single one of us knew it was going to happen. So, go on.
I suppose for me, the number one thing I would put into this is Nightingale hospitals, because they can get them set up in a week. They've done it. Like, all the engineers that did it the first time are still there, and it's not like it's even a hypothetical. So in the end, I think if they just started that now and then use the care homes for to put people, because right now one of the things they are trying to do, and one of the reasons this is a thing, is because they're trying to move people out of the hospitals in order to increase capacity of the hospitals, which is good, question mark. Like, the hospitals need more beds free. That's fair. But in the end, you could move them to the Nightingale hospitals. Then they have plenty of time to test. Then they have, So it's not that there's no options to solve the very real problems that actually exist.
It's also that a Nightingale facility is, to a certain extent, the perfect solution, because number one is the very clear evidence. We've known for decades that hospitals are bad at giving non-acute care, particularly to disabled people. There's horror stories across the board, and when they're prioritizing on a pandemic level, it's going to slip even further. So it is understandable that we want the patient themselves and anyone that wants to get out of hospital. It's not a fun place to be in there. Trust me, I've spent months and months in hospital. It sucks. But the additional issue is you can't then go, we need to get you out of a hospital, so screw everyone in that care home. Because it's negligence. It quite literally is negligence to say, we can put in precautions. Okay, then put in a precaution. We only ask simple things. One, recreate the Nightingale facilities so that there is somewhere for these people to receive the non-acute care that you're demanding that they receive and that they are entitled to receive. It allows ample time for testing, as Peter, you mentioned. It allows you to also get the fundamental simple one, which is, do not discharge someone into a care home, or do not have someone enter a care home as a new patient, as a new care in. I keep coming back to the word inmate because of the whole independent living campaign, but as a resident, I think is a preferred term. As a resident client, without a negative COVID test. If you haven't got a negative COVID test, or the government can't prove, or the local authority can't prove that you definitely do not have COVID, don't put them into an environment where they are going to be at risk of making things worse. Because we touch on the human aspect quite a lot in the disabled people's movement, but what hasn't been caught on national media, it's not been caught on social media, is the impact it has on that person. because you are being discharged. You know that you most likely may have COVID. You feel crappy anyway, but you are being discharged into an area where you are living with people that you come to love, you come to make friends with, and you are putting their lives at risk, and that will destroy your mental health. And that is not what is necessary. Mental health issues in care homes is an issue already.
Yeah.
We don't want to be expanding that. So as a mental health preventative, as a death preventative, as a you're doing negligent things preventative, it's quite simple. If you're a policymaker, if you're a person in power, 1, listen to disabled people, 2, campaign to reopen the Nightingale hospitals, and 3, most importantly, campaign on a policy, on a national policy, that unless that person has a negative COVID test, they are not allowed back into the facility or be discharged into a facility if they're a new client or resident. It's really simple. You know, you can quite literally write it on a bullet point, on a post-it note, and stick it to your forehead or your computer screen, because let's face it, we're all behind
boss's
computers.
forehead,
or
in
your
their
boss's
eyelids,
or in their eyelids. It's a very simple ask, and it really does come down to, we've had 6 months to prepare. You didn't listen to us. Listen to us this time. We can't. It is negligent to sit by again and watch 30,000 excess deaths accrue.
And to some degree, they'll need the Nightingale hospitals in probably a month to 2 weeks anyway. Honestly, given the uptick, given everything, so in the end, get them built a bit earlier. Use them for something good in the meantime, and yeah.
Haven't they been mothballed anyway? The ones that were created, haven't they been put on ice?
I mean, yes, no. I mean, mostly they were built in massive conference centres.
Yeah.
So the conference centres still exist, but it's just that basically what the engineers came in and did, as far as I know, is basically built like all the ward equipment and put like sheets around everything, and and made sure made it kind of hospitally. So
they've rapidly increased the hygienic capacities of these centres. They were done in convention centres, large sports halls.
Yeah.
I know that some universities gave up their sports halls so that they could be converted into these hospitals. And it's not like they should be used in a pandemic anyway. Like, we're not saying to a convention centre, oh, please don't hold your conference because we need it for a Nightingale hospital. We're saying, you've got it empty because you shouldn't be holding a conference.
Yeah.
It's a pandemic. And if you need a Nightingale hospital and you need these facilities, they're not going to be used anyway. So it could also support these art centres, because that's something that's been forgotten as well, and is a podcast for another day. But it's a way to support these centres to continue thriving as well.
Because they're getting paid for this. Like it's not.
Majority of the institutions that volunteered their spaces, obviously they volunteered them.
Yeah.
Not getting paid, but some of the ones that were just so key or so important to, they did get some financial assistance with supposedly lost revenue, electricity costs, obviously, because that's all we're around. But it's very simple. Like, they're still there. They're not. It's not a. This isn't a philosophical question of, do we have the capacity? Yes, we do. Yes, we do. We've proven that it can be done in a week. We've proven that they can be staffed. The thing is, get the PPE sorted, get the testing sorted, and ensure that disabled people we're not the ones bearing the brunt of this yet again.
And the government needs to stop lying. For example, in one of the panel meetings, we had the Great Manchester Track and Trace people on, and he was sat there going, when the health secretary had announced you would be able to get your test results in 90 minutes. We asked the guy the next day, the guy goes, no fucking chance.
Wait, that's the thing. Like, most people don't even receive them within 24 hours.
Yeah.
I think 48 is kind of when they're, which it's not the worst, but it's not great. No, but it's certainly not world beating.
No, but that was the time scale they were working at. He said that's the real time scale. If they can get it down to 48 hours, they're happy. That's the quickest they can do it, he thinks, unless they come up with another test, which was there was a potential one about a saliva test, but that's not taken off yet. So at the moment, they've only got the 40-hour thing. So what I'm trying to say is the government needs to stop having these moonshot policies and fix the things they actually got, and then those that work, just do them as efficiently as possible.
I mean, it's also the fact that moonshot is not going to be free as well. Like, the one thing we need in a pandemic is rapidly available testing, not rapidly available testing for those that can afford it, because that's not how the bacteria doesn't. Sorry, the virus, I should say. The virus doesn't ask how wealthy are you. Oh, okay, yeah, you're well off. Okay, I'll infect you so you can go and get a test. That, if anything, we've already found the rates of infection. If you're on a front line, if you're in a shop, if you're a shop worker, if you're someone that has to work during a pandemic, you're more than likely to be lower class, to be working class. Which means that you're also more likely to be unable to afford these rather expensive tests. So it's both an issue to do with care homes, but also an issue to do with the sort of the healthcare and social care infrastructure as well.
I mean, I haven't actually heard about moonshot. Is the government giving extra money to care homes, to councils, to the NHS in order to use these tests? Because honestly, if they're not, then honestly, all these moonshot tests are basically fundamentally irrelevant to this discussion.
They realistically they are, but the only relevance they have is that the workers in care homes, for example, could theoretically purchase them. The primary issue with testing as well is that the government announced a budgetary cap for hospitals to be able to test in the first place. So that is quite relevant when we're asking for a simple ask, which is a negative COVID test, is that cap has to be lifted so hospitals can ensure that patients that are to be discharged can be tested, or at least a supplementary funding. If you are a policymaker or you're a minister of government listening to this, hello, welcome to the other side of politics. We welcome you here. We're quite friendly usually. Please do. The amendment bill's coming up, of course, in a couple of days. The COVID amendment bill. Talk to disabled people. There's lots of DPOs in London that you can talk to. I know Inclusion London has been trying to email you from the work that I've been doing and
Disability
the friends that
Rights
I have.
UK.
Disability Rights UK, there's loads and loads and loads of disability organisations run by disabled people with lived experience of disabled people with some excellent, truly excellent policy and expertise knowledge on care homes, on disabled people's lives, on healthcare that you can just tap. You can go, yeah, sure. We can have a Zoom call, we can have a phone call. So if you're listening and you have those powers, reach out to them. For the love of God, or follow him if you really don't want to talk to a London one. I'm sure Manchester's Disabled People Against Cuts would happily talk to you for 30 minutes to say.
Or the mayoral panel, even.
Or the mayoral panel, the Greater Manchester.
If you want to be more pretentious.
Just out of interest, just so that we can get to the bottom of it ourselves. Why do you think they're not talking to us? I
mean, I've got two answers. The first is I'm a cynic and they don't care. That's a big one. It was clear from the if it was a clear priority, if people currently cared, other than disabled people, because it's a big looming prospect that we're going to die for some of us. Strangely enough, that gives us a little bit of a kick to make us give a shit.
Yeah.
The prime aspect is let's face it, if people truly did care, and I don't mean offhand care, clap every Thursday for NHS workers caring, I mean actually care, then this would have been fixed in the last 6 months. So fundamentally, the first stop is that it's not a priority. It's not a true priority for them. Yeah. The second answer that I have is it is a convoluted system. It's a difficult system. That people don't take the time to get to learn. Bearing in mind that the majority of people in Parliament, the majority of people of civil servants, the majority of policymakers don't interact with care homes and don't interact with disabled people unless it's their parent or their sibling or their aunt or their uncle that ends up going into a care home in their later years, or acquires a disability in their lifetime, or is disabled themselves. It's only through the lived experiences of themselves do they suddenly get that sort of knowledge kick. So that's something to bear in mind as well, is that there is a lack of knowledge, which is why I often go into this long soliloquies of the current situation on a policy front with the stats, the statistics. It's because it's okay to say, I don't know. The issue is you can't say, I don't know, and then not do anything about it. So as a final plea, and I've done this a couple of times already, but final plea, follow MDPAC on Twitter. I think it's quite literally just at MDPAC, MDPAC, or if you hate my nasally voice, that's Mother Delta P.
Peter?
Peter, yeah, Mother Delta Peter Alpha Charlie. That's MDPAC. You'll find them on social media. You can sign the petition. There's a Change.org petition going right now, which is calling for everything that has already been mentioned. You can sign that. You can share it. I think Change.org say that it's equivalent to a £3 donation to advertising if you personally share it. So sign it. Make sure you share it on your social media. But also contact your local health board. Send an email to your local council and say, hi, worried about this. What's our local policy? What's going on? Because that is important as well. We need to find out what's happening on a local level, because national policy is the minimum standard. If care homes in your local area are thinking about doing this, you can get them to commit to it themselves. And if all the care homes in the country turned around and said, we're not taking a single patient back unless you can prove they're COVID negative, it would happen overnight. So that sort of work is incredibly important. It takes 30 minutes out of your day to construct a long, lengthy personal email. You might even spend just 5 minutes just doing a quick question. But you spending that 5 minutes or to follow people on social media, to sign a petition and then send an email, or just one of those, can significantly change the policy landscape of the country. Trust me, I've managed to get things changed in government. I've managed to get things changed in the House of Lords. This is the work that I've been doing, in the last half decade or so. People do achieve change.
But I was just going to say, I know we've already talked about it a bit, but should we go on to talk about the campaign? Like what we hope to achieve and what we hope to get from it and what the aims of it are? The bits of it we can share?
Certainly. That's more. I think that's definitely much more of a conversation for all three of us to chip into. I know from my end, of the things that the three things I've already mentioned are what, to a certain extent, anyone can do. Anyone can get in contact with your local MP. Anyone can get in contact with your local health board, your local council. It works even better if you've got nothing to do with the disabled community to a certain extent, because unfortunately, you get listened to more than we do. You have a power that we often, we get called self-centered because we're talking about ourselves. And yeah, we are, but by God, it's something everyone else should care about too. But the other side of the campaign as well is support. Galvanizing this support isn't going to happen overnight. The type of campaigning action, the type of campaigning groups, the aim is to get commitments from local government, so your local council, your health board. The aim is to then use that to change national policy, because if national policy changes, then everyone's got to listen to it. When NICE publish their guidance, people listen to it. Yeah. So it's fundamental that we attack both.
I would also put in this point, unions. In the end, if you work in a care home, if you are anything from care worker to manager to blah blah blah, then actually joining a union, pushing them to try and make basic standards higher, actually that helps too. That because in the end, to some degree, care homes can refuse to allow anyone in who hasn't got a negative COVID test. And in the end, if all of the, and in the end, councils have to respond to that. like they have to use those services. They have clients who need them, and so they will pay for those tests if they have to. And if they and so if you and to some degree, part of this is that councils think that they can basically, if they just shove money into the mouths of care homes, then they will not. Then they will just go, oh well, maybe the risk is worth it. Maybe the risk to our clients, to our staff, maybe it's just worth it. Maybe that's just how the business goes. Well, that doesn't have to be how the business goes. You have that, like, and in the end, especially with unions, and especially if everyone gets on the same page along this, it is thoroughly not the business. Sorry, Shabazz.
And just on that point, there is actually a disabled union now. But I don't know how good they are or anything. But I'm just making the point that there is actually a disabled-led union, and yeah, unions are another avenue that needs to be tapped into, because me and Pete went to a meeting of theirs once, and around carers and stuff, and they kind of only thought about it, well, in a way, rightly so, but they only thought about it through their own limited lens of the care workers. They didn't really think about it as the co-relationship between the service user and the carer, or whatever you want to call it, you know. And that blew my mind in a way. It's like, what the fuck? You don't think. It was almost like they think of the disabled person as just like a machine that these carers have to look after. And it was like, hang on a minute, you know. We need to have a mutual like understanding of each other. We both rely on each other. And
just to point out on a slightly more optimistic note, GMB are already putting out questions and petitions around York specifically on this topic. I've also managed to get some response from Manchester, from Manchester's trade union council. So to be fair, like, yes, I was at that meeting and they weren't great, but they can be swayed. Unions are relatively malleable in this way, that it's not that hard to go to meetings. And honestly, if you have 2 or 3 people who are willing to go to those unions and put forward go to those meetings and put forward arguments,
it's one of those ones where it's spaces, any space where a disabled person often doesn't get a voice in, comes out with really, really disabled views often. And we're, you know, quite literally talking about A plus B equals C. You know, don't have A, you get a B equals B. Fundamentally, unions as well, it's important that DPOs, disabled community people, work with the workers, because the easiest tactic that people in power do when someone challenges them is set someone else against you. And if we're already working together and we go, no, the workers are on our side. We've got our carers, our PAs, they agree with us, and fundamentally most of them do agree with us, because they don't want to see us dead. They don't want to be at risk of catching COVID themselves and pass it on to their family or their children. You know, the Q Simpsons meme, will somebody think of the children meme. And, you know, it's this thing of, it's important that we work together, because we are quite literally, we've already mentioned it, challenging people in power. We're challenging the people that run our local systems, our local councils. And if they see that the workers and the client, the disabled person, are already united, they can't, you know, send disinformation that way or disinformation that way and say, well, we really want to ensure that you get a COVID test, but the unions have told us that they have to have a COVID test. And we've only got a limited amount of COVID tests at the moment. So either you get COVID tests or the workers get COVID tests. Whereas if we're working together, we can go, no, just give everyone a COVID test that is in that situation. You know, we're not talking about 66 million people in Britain. Well, if we can't give 66 million people in Britain a COVID test, might as well give nobody a COVID test. We're talking about people according to the ONS stats, 60% of disabled people that died from COVID were disabled. So it's essential that we give those people COVID tests because at risk, we're talking about frontline people, they're most at risk. We should give to people that are working with disabled people, therefore, tests as well. It's not a big ask.
Because actually, if you look at the people on the workers' side who died of COVID, I think number one was care workers, number two was nurses, and healthcare workers. So I think so being a care worker is in this context is really dangerous, but it's actually partly it's dangerous.
Still less dangerous than being disabled.
But partly it's dangerous because the people they work with, they don't know if they have COVID. And so actually, if more disabled people were, especially in care homes, were actually tested themselves, then actually it would decrease the risk up and down the line.
Very much so. It's a domino effect, as it were. I think it's also important to note that the two professions that you mentioned within the sort of healthcare industry are very low paid. And the additional one as well that hasn't been touched on, and I did want to mention it. I know we've only got a little bit of time remaining, but it is the fact that there needs to be from our movement, disabled people movement, there needs to be an additional look at the other barriers and the other intersections that are within our community. We need to, in particular, need some dedicated support to ensure that disabled people of colour are targetedly supported within the approach that policy has, because policy isn't always known to do intersectional approach. Policy is known to go, well, we're targeting disabled people today, and we'll take racism, anti-racism tomorrow, and we'll do women the day after, and we'll do class the day after that. It's important that we have a multi-liberation focus on the work that we do on the communities that we build as well. And I'm sure Shabazz has a better experience point of that than myself.
And at this point, I can't resist put you on the spot here, Piers, and ask you a rather big question in the sense of, because we've talked about numbers quite a lot and statistics, and this is not just a question for you. This is a debate point for all of us. It's like, how do you think we go about fixing the way we get more accurate data on disabled people? Because as far as I can see, we can only fix the problem once we know the accurate size of the problem.
I do agree with you 90%. I will say that, it doesn't take a genius to work out that disabled people are being screwed by this pandemic. So we don't really need the stats on that, to say we should do something. But you are right. We can't really address the root of the problem, the systemic cause of the problem, unless we have reliable, and a word that I like to use is meaningful statistics. Okay. Statistics is great, but if there's no meaning behind them and they can't be used meaningfully, you're not going to get what people like to call in government, which is impactful results. It needs to be impactful. What we do needs to be impactful. That's, you'll see a politician talk about it on TV all the time. Yeah. But we can't get that without having meaningful statistics. And the way in which we do that is, by and large, ONS, YouGov, every one of these think tanks and these policy research departments need to fundamentally hire disabled people. Because this is something that I've been working on actually the last couple of months, and still unemployed, so doing freelance work, but still technically unemployed. So if you're a policy think tank, listen to this, hire me. But fundamentally, it comes down to making sure that you have disabled people in the room to say, hang on a sec, why the hell are we using the definition of disability to be extremely limited limited a lot and limited a little? Like, a single disabled person in that room when they were looking at the article, the stats that they were creating, would have gone round and gone, this is useless. This is fundamentally useless at working out disability. Regardless of the 10-year time gap, because, once disabled, you're most likely not going to, nobody's coming around with a magic wand and going, hey, you're no longer disabled. But fundamentally, like, the definition of disabled there is not just out of date for 10 years ago. It's out of date for like the last half century, considering the social model was conceived, written down, whatever you want to call it, in the 1970s. So fundamentally, it is quite literally just get co-production from disabled people. If you don't have any disabled people and you don't currently have any open job vacancies, which is, let's face it, is probably going to be a lot of the organisations. Nobody's really hiring in a pandemic, trust me, I've been struggling myself. Reach out to your local DPO. Reach out, if you're in Manchester, the Greater Manchester Coalition of Disabled People, MD PAC, the mayoral panel. If you're in London, there's Inclusion London. If you're anywhere in the country, there's ROFA, the Reclaiming Our Futures Alliance. Alliance, yeah. ROFA Alliance, it's got Alliance twice. It's a fun thing. They will be able to help you find a disabled people's organisation that can at least highlight the glaringly bad assumptions that you've made when trying to create these stat reports. Also, don't do an online survey to work out things to do with disability without considering digital accessibility. Because disabled people, by and large, have multivariate, we're all different, but one of the big differences is that we are systemically more likely to have issues accessing online content.
Yeah. One of the things that has become glaringly obvious in the last year, for me especially, is the digital exclusion that disabled people face. It's quite shocking. It's like almost like poverty is to like far big parts of the world. It's like shockingly, like it's unbelievable, and you're literally cutting people off, like most disabled people are interacting on Zoom, and now can you imagine people or on any other platform, but can you imagine if you can't afford a computer or you haven't got the ability to access the computer yourself, you're just lost, aren't you?
It's definitely I definitely say this is a huge topic that I can go into. So I work within the digital technology industry. I sit on different groups, assistive technology groups, founded a couple, been a founder of a digital accessibility working group. I'm a member of the Assistive Technology Network. I 100% agree with you. We're now in a society that I like to call digital by default. Any young person that is applying for a job in the last decade will have had this conversation with their parents or their grandparents. Their grandparents says, oh, just go in and hand them your CV. That's not how it works these days. You can't just give someone your CV. They say apply online. If you're trying to apply for social security, it's apply online.
Yeah.
If you do not have the money in the first place to have a bit of hardware to be able to engage on social media, to be able to engage on digital campaigns, we're in the middle of a pandemic, let's face it. You can't go to the library. If your library hasn't been closed already in terms of government cuts. But you then also can't apply for Social Security because you have to apply online. And yes, they say that there are phone lines that you can call to be sent a paper copy. But there are systemic issues. There's two categories that I like to say. Digital disadvantage, which is you have the technology, but you don't have the right assistive technology or the right designed. So you might have a phone, but you're struggling to access things because you don't have the right software or the right bespoke software or hardware. And then there's digital poverty, where you just can't afford anything. You might be able to afford a smartphone, but you won't. There are people doing their PhDs on their smartphone. Let's put it that way. So there are systemic issues with that, and that is if you are listening to this and you want more on that topic, and you really want to see what's going on in the digital technology world regarding assistive technology, regarding digital poverty or digital disadvantage, give me a follow on Twitter, because it's all I tweet about. It's all I really go on about. It's quite literally my life at the moment. I say moment, it's been going for like 5 years. It's my hobby. I don't run marathons. I don't go outside. I do digital technology. But on that, if you're listening to this, you've most likely got access to hardware. That's the point of a podcast. You most likely have downloaded this, or a friend sent it to you over Facebook, or you saw it on Twitter.
Yeah.
Either that, or the podcast fairy has come around to your house and and is reciting what we're saying.
Exactly. So when you engage with our campaign, my personal preference will be for you to think about someone that won't find us on social media, won't find the campaign on social media, or doesn't really engage with technology devices. So I'm going to stereotype here and say, think of your grandparents if you're a young person, think of your parents if you're middle-aged yourself. Think of people that wouldn't necessarily interact with our campaign or the digital technology world, that would be reached by the usual means of you click and share. And give them a bell, give them a phone call, say, look, there's this thing about care homes I want to talk to you about. The way in which I got my parents involved was I jokingly told my dad, this is where you'll end up in 10 years' time. You might want to give a crap. Because that's the relationship that me and he have. We rib each other all the time. He tells me to, do jumping jacks and things like that as a wheelchair user. It's that sort of working class, disability related family. But you can engage people that wouldn't necessarily come across things in particular, because we've got a paradox, which is we're trying to reach people that inherently have barriers in what we're trying to reach them with. So if you can do us a favor and just contact one person that you wouldn't think would necessarily engage with our campaign or engage with things, or would prefer to write a letter rather than an email, because it's much harder to ignore a handwritten letter to your local council than an email. Reach out to them, get them involved, tell them about this campaign, get them to write that handwritten letter with if they, I've not sent a letter in years, so I can't remember how it works. But if that's their thing, that's their thing. So do us all a favour, and that's my big ask. The little ask is just share the campaign in the first place.
So the goal of the campaign is to obviously avoid the deaths, right? But what else on top of that do we want the overall policy to be changed, or what are we asking for? Just to crystallise it for us.
First things first is all possible procedures in place, from local council all the way up to national policy, to ensure that we don't have a repeat of 30,000 excess deaths.
Yeah.
Like, saving people's lives has been a tagline for the entire pandemic. Yeah. But really, if you've ever tweeted saving lives or the hashtag, or clap for the NHS, this is something you can do. We want to save disabled people's lives in care homes and institutions. We want to save the workers' lives that are interacting with us and supporting us, that are helping us, that are doing a job that is already undervalued in society. They really don't get paid much, let's face it. They don't get paid enough to potentially interact with someone that is COVID positive. That's my personal opinion. So there is a strategic aim to reduce deaths, as you've said. An additional aim is to get this as a national policy of ensuring that we are protected, because we shouldn't just be, please don't kill us. It should be, what can we do to ensure that you are at the forefront of our strategy to reduce the deaths in this pandemic? Because if the ONS's own stats show 60% of deaths are disabled people, and if you add on care homes with my own little bit of data play that I did myself, and it's at least 74%, 75%, then if the government and local government and the country as a whole want to reduce the number of deaths, then you've got to be protecting disabled people. It's an anticipatory response from the clear thing. So that's the second one. And then I will shut up very quickly. The third one is that we want to make sure that the conversation about this isn't done and over, that we don't just protect care homes, that we build a community, first and foremost, of people that will help us in future, and that will be with us in future, that will campaign with us in future, and lobby with us in future, but also so that disability isn't an afterthought. After the pandemic, we're not going to go away. 20% of the population in the UK isn't just going to disappear, even though some could argue they're trying with this pandemic as a bit of a black humour joke, dark humour joke. It's all about putting us at the forefront of the conversation in a pandemic where it's killing us first.
Could I just put something forward quickly?
Yep.
The minister in charge of this is Helen Whatley, who, if you go through our back catalogue, we've had some fairly harsh words on her. But basically, this is something that she is literally the minister of, and so anyone who wants to can write her a letter because she is specifically responsible.
I do hear that a Conservative MP does like it when you send them a handwritten letter.
Yeah. Because
So
that's what they used to. Is there anything else you want to say, Pete, or Piers?
I would personally say is I've mentioned a lot that can be very difficult to listen to in terms of just absorbing. I struggle it with myself. My hearing's not great. My processing's not great. If you've got any questions and you're listening to this and you're going, how do I ask people on a podcast that I can't directly interact with? This isn't a Twitch stream. You can't stick a comment in a chat. My Twitter is at Piers42. So that's Piers, spelt like Piers Morgan, but I'm honestly not that much of a dick. Piers42, it is a Hitchhiker's Guide to the Galaxy reference. So if you've got a question, hit me up on Twitter, tweet at me, and I'll get around to replying if I can. And that way, I've said a lot of stats. I can give you some of the sources. I can give you a direct link. They're in PDF format, ironically, so they're probably not accessible if you use a screen reader. I cried myself trying to do this research myself. So if you've got questions like that, please do contact me and shoot me a message.
Yeah. Is there anything you want to say, Pete, before I say a few things I want to get off my chest before we close?
No, I think we're done.
Yeah, and I just want to say to anybody listening out there, and to anybody who can make some real change, just get off your ass and just do it, will you? Because I know this gets said a lot, but it really is true in this case. That is a fucking life or death issue. And I, for one, don't want to die just yet. So please stop trying to kill me. And if you're listening to this once I'm dead, I told you so. So come on, help everybody's life, and let's live a great life together. Cheers. Bye.